Good day, everyone, and welcome back to our training on Advanced Basic Life Support for Prime Care Nursing Practice. In this video, we will continue our discussion on airway and breathing management. But before we proceed, let's quickly review our previous lesson. In our previous lesson, we identified the causes and signs of airway obstruction in an unconscious patient. And we also demonstrated the head tilt chin lift and jaw thrust appropriately. Now, back to our topic. By the end of this lesson, the participant will be able to assess breathing using look, listen, and feel within 10 seconds, and also demonstrate rescue breathing using a pocket mask or BVM with visible chest rise. Now, let's get started with how the airway opened in a trauma or suspected spinal injury patient. When trauma or spinal injury is suspected, the airway should be opened with the jaw thrust technique if the rescuer is trained to do so. This is used because it helps open the airway without moving the neck as much as head tilt chin lift. The jaw thrust pulls the lower jaw forward, so the tongue is lifted away from the airway while reducing neck movement. To perform a jaw thrust, place the hands at the angles of the lower jaw. Lift the jaw forward using the fingers. Keep the head in a neutral position as much as possible. This is especially important in performing a jaw thrust. Road traffic accidents, falls, sports injuries, facial trauma, any collapse where spinal injury is possible. Note, in suspected trauma, protect the neck while trying to maintain the airway. Now let's look at how breathing is assessed quickly and correctly. Breathing is accessed quickly and correctly. After opening the airway, breathing must be checked quickly using the look, listen, and feel method. This should take no longer than 10 seconds. If there is no normal breathing or only gasping, the person should not be treated as breathing effectively. In simple terms, this step tells the rescuer whether the person is breathing normally, needs rescue breathing, or needs full CPR. The first step is look for chest rise and fall, signs of effort, and visible movement of breathing. Listen. Listen for breath sounds at the mouth and nose and normal air movement. Feel. Feel for air movement on your cheek. Note, do not spend too long assessing breathing. Quick action matters. Finally, let's look at how rescue breaths are given effectively. Rescue breathing helps push oxygen into the lungs when the person is not breathing adequately. Rescue breaths may be given using either a pocket mask or a bag valve mask. Each breath should last about 1 second, produce visible chest rise, and not be too forceful. Visible chest rise is the best sign that the breath is entering the lungs effectively. If the chest does not rise, the rescuer should reopen the airway, improve the mask seal, reposition, and try again. Pocket mask. The pocket mask should cover both the mouth and nose and create a good seal. Bag valve mask. The BVM is used to give breaths through a mask connected to a self-inflating bag. Good technique requires correct head position, a proper mask seal, controlled squeezing of the bag, and visible chest rise. Note, effective breathing is not about giving large breaths. It is about giving the right amount of air with visible chest rise. In summary, use the jaw thrust technique to open the airway while keeping the head and neck in a neutral position. This protects the spine. While checking breathing fast always, look, listen, and feel. Watch chest rise, listen for airflow, and feel breath on your cheek to decide if the person is breathing normally or needs help. Also, use a pocket mask or BVM to ensure a tight seal and proper positioning. Give 1 second breaths with visible chest rise. If no rise, reopen Airway, reseal, and try again. That is it for this session. Thanks for watching. See you in our next session.